Our partnership with ASQ began with an initiative from Mayor Barrett. He signed a partnership citywide with the leadership at ASQ, the American Society for Quality, and they held an open house for us to go and look at some of the tools, programs, and courses that were provided by ASQ for the city. When we went to the open house, we were able to see a lot of the different tools that could help us at our lab to improve the quality of our services that we provide for the city. So we went through some of our granting opportunities and our funding opportunities, and we came across a funding opportunity for quality improvement with the Association of Public Health Laboratories. And they allowed us to fund the coursework for Quality 101 and get over half of our employees certified as Certified Quality Improvement Associates. We have about 25 people in the laboratory, out of which 14 became certified, and we were able to have them actually form a QI team, and they went on to really spread the message of quality improvement in the laboratory.
City of Milwaukee Public Health Laboratory is a regulatory laboratory, and we are pretty organized in terms of responding to our City of Milwaukee need for the laboratorians. And also being part of the regulatory agency, we are very keen to the regulatory guidelines. So when like one of our peers mentioned a few minutes ago, that when he got certified and got ASQ involved in the process, we thought this is a golden opportunity for us to improve some of the opportunities that we can have and some of the laboratory efficiency initiatives we started. So being in a regulatory environment, we are already following some of the guidelines, but bringing in ASQ tools like 5S or the Kaizen for the small projects is definitely empowering people, engaging into everyday's quality life in the laboratory. And this is one of the big picture, not only for the City of Milwaukee Public Health Lab, but for the nationwide laboratory efficiency initiative is a big issue. And we thought partnering with ASQ and bringing in the tools they have offered to us and our staff being certified will be a great addition for us to continue our quality initiative in the public health lab.
We started up a Lean initiative a while ago and wanted to build upon those initiatives that were started by our lab director. So what we decided to do was formalize our primary visual display board so that way we would be able to measure some of the testing and the services that we provide for the city and be able to create control charts to know how we are doing in terms of providing services. And from there, we up-ramped our huddle meetings to become daily. So that way we had daily huddle meetings to have passive communication. And that just allowed us to break the silo culture that was starting to occur in the lab, just due to space and the microbiology lab. So with those huddle meetings and the primary visual display board, we were able to really show passive communication. And that allowed us to do projects like our gonorrhea chlamydia testing, where we were able to lower the testing rate by like 10% in terms of cost, and also do other projects, especially 5S projects in our microbiology lab.
We have a very good strategic map that has worked out, which is aligned with the city strategic mapping as well as health department map, and that's also aligned with the national strategic map for the APHL, or Association for Public Health Laboratories. So bringing in some of those initiatives and the smaller projects we have already started and practicing in almost a year now, we want to see next that how we can spread these tools and continue to improve some of our larger projects that we would like to bring in. Now, bring in the quality initiatives, not only just the employing the tools, but also empowering people that who are the key. So we want to make sure that we engage almost all of our staff, even though 60% above our staff are quality certified, but bringing them into the project and empowering them, have the self-initiated projects coming out. So that help our management as well as improving the laboratory operations in everyday's life. And impacting that overall with the MHD association and impacting to the community is what we would like to see. Given that our impact on the local public health lab in connection with the state public health laboratories and other agencies we work with, we're also very much tied up with the Association of Public Health Laboratories to tie into the national strategic roadmap for quality improvement for public health laboratories. And we are going to be one of the pioneers bringing in ASQ tools and practicing that, continue to practice that in near future. We continue to work on the workforce development and bringing in more of the future laboratorians, and we make sure that they are quality laboratorians coming into the field. And the services, we offer services to the citizens of Milwaukee and beyond, and partner with our industry partners as well. So we also want to make sure that all our strategic initiative doing the quality improvement in the lab also impacting the services that we are offering. We want to set up a tradition for this laboratory for decades ahead to continue the quality improvement in our laboratory. And public health lab being the forefront of the response to the emergencies and challenges we have are the technology, sustaining the workforce, but we want to make sure when we are asked always to work more with less. We want to make sure we do it strategically. We continue to practice our quality practices in the laboratories, and that's a way to continue our track record that we have maintained so far in our public health laboratory.